The overarching goal is to demonstrate that PMPs are effective, that they have an impact on prescription drug abuse.
The individual states are setting up these programs now across the country, and thank God they are, because we certainly need them. The people involved are exceptionally busy just meeting the needs of the day-to-day work, which is to get reports up and ready and out to prescribers. It is a very major task. The capability then to evaluate the information, to look at it, to study it, to see what it means, is something that most states do not have the luxury of doing.
A large part of the role of the Center of Excellence is to provide those kind of studies, either to do them directly or to facilitate other researchers doing research on prescription monitoring program and on how the data might be used.
PMPs have very valuable data that can be used by, let's say, drug treatment programs, by people engaged in prevention of substance abuse.
Part of our charge is to identify best practices among state PMPs. Because they differ in so many ways, we can't identify best practices across the board, but we've been focusing on selected areas. An additional key piece of the Center of Excellence is to provide a clearinghouse of all sorts of materials, but especially academic research materials on prescription monitoring programs or of interest to prescription monitoring program administrators. The clearinghouse material is on the website. We write journal articles. We make the abstract, which is public available in the citation, but we also write summaries of what we think are important themes in certain research literature that might be of interest or use to prescription monitoring program administrators, and make those summaries available as well as links to the specific citations and abstracts. The Center of Excellence started in February of 2010, so we're still adding activities. One of those activities is a forum on the website for online conversation between researchers and other people of interest.
So the Center of Excellence is trying to develop the resources, the financial support we need, as well as to explain to all of these other interested parties what we can do to help them, and then to do the work to get it out to them so that they can actually take advantage of this very rich and important resource of data that can help steer policy, it can help steer action at the community level, at the state level, and needs to be utilized.